I suppose the first thing I'll declare is I'm not going to come up and give you the solution to all of your assessment problems in terms of load and sequencing this morning. I don't have the golden bullet. I wish I did. In fact, by the end of this 20 minutes or so, I hope that what I will encourage you to do, if you're not already doing it, is to think a little bit more critically about your role in assessment, the assessment within your modules, and I think more importantly when it comes to load and sequencing, how the assessment within your modules fits within a wider stage, wider programs, and so on and so forth. So what I'm going to do is talk about, first of all, what we are currently doing now. When I say we, I'm talking about UCD. And then why are we currently doing this, looking at some of the things that are influencing our decisions and our choice related to assessment currently within this institution. Then I suppose we need to think about, is it time for change? There are a set of principles on best practice that were established by the UCD teaching and learning team, Geraldine O'Neill and Elizabeth Noonan, back in 2011-2012. Are we really looking at these? Are we considering them? Do we need to consider them within our assessment approaches as well? So hopefully we'll start considering some of the challenges we face and also some of the potential solutions to assessment sequencing and load. What I'm going to use to inform this presentation is some of the work I've been involved with now. We're in the fourth year with two of my fellows, Susie Gearan from the School of Psychology and Michael Staunton from the School of History and Archives. Where back in 2011 we started looking at the practice of assessment in first year across the university here in UCD. Now, what was a 2-year project, we've continued to work on that, and we're now entering our fourth year exploring some of these issues across the university. Also, a couple of years ago, we were approached by UCD Teaching and Learning to be one of the pilot programs. At the time, I was the coordinator of the BSc Radiography program. And we volunteered that program to go through a curriculum mapping and assessment redesign process, which really got us as a team to start really critically thinking about our assessment within our programs. That has been extremely useful for us as well. And then more recently, in fact just last week, we had our review meeting by CORU, who are the new regulator for the health and social care professions, who are currently reviewing, well, just finished their review of our BSc Radiography program as well. And again, assessment and mapping related to assessment was a big part of that review. So as you'll all be very aware, assessment is obviously a central part of teaching and learning practices and policy. But there is evidence from the literature and scholarship around this area that the awareness of, and I suppose a more critical awareness of assessment within our programs is coming through more and more within the literature as well, as is variation in assessment. Now immediately people say, well, that variation in assessment is largely technology driven, we're doing more online assessment. And yes, we are seeing more literature related to online or technology based assessment, but that's not always the case. By doing things, looking at new pedagogical approaches, flipping our classrooms, which I'm aware some of the modules in the nursing programs are doing, gives us the opportunity to rethink our assessment and take novel approaches to assessment as well. So it's not all technology driven. The literature also quite clearly says that this is a big area for improvement. Assessment is intertwined with what we do in teaching and learning, but often we come up with the content of the module, the structure of the module, we think about a good approach to delivery of that content, and then the assessment often follows that, often but not always. But really it is intertwined, and it's often neglected that the literature suggests, and it is an area we can still do a lot more in terms of improvement. Obviously, any developments in terms of assessment can create some problems for all of the stakeholders involved in assessment. New approaches to assessment can present a headache for the staff involved in that, trying to get to grips with new assessment approaches as we move away from traditional approaches that we're more familiar with. Likewise for the students, we may think these young, enthusiastic, motivated students coming into us are going to be very open to lots of different forms of assessment. But again, they've gone through a second level education, which is, quite a limited range of assessment approaches in there. So there's challenges from the student perspective as well. Also from the workload. Some assessments suit some students and some assessments suit some staff. So what may take one student 5 hours to prepare for could take another student 30 hours to prepare for that same assessment as well. So looking at some of our fellowship work, and this project we started back in 2011, we aimed to look at the practice of assessment in first year. So we were focusing on first year across the university. The reason for that is the then educational strategy had, one of its key aims was to foster early and lasting student engagement. So the first year experience was at the heart of many aspects of the educational strategy. And it also looked at, or suggested that we needed to review and reform the outcomes, the structures, the assessment, the remediation opportunities within our modules and within our programs as well. At the same time, as I mentioned already, there's a set of assessment principles published, and I'm going to come back to these throughout this presentation. So I won't go through them in detail at this point. But again, these weren't a set of rules for us all to do in every module we deliver. But these are some evidence-based principles that suggest if you can intertwine these into our modules and intertwine these into our assessments, you can get better outcomes as well. So what we did as part of our fellowship work, we reviewed all of the core first year modules across the university. So there are 627 modules in total. We looked at the module descriptors, so the online module descriptors initially across all of the colleges, and apologies, one of the colleges is missing off that list. And that represented 53 core modules from the health sciences programs within this university. Just in terms of the range, the variety of assessment that's in there, we're looking at the types or the mode of assessments here. This is what we found from the module descriptors, and this may be quite hard to read, but the biggest column there with 414 instances are examinations. Now, I must mention that all of these titles across the bottom here are all the predefined, or what were then the predefined titles on the module descriptors. And as for those of you who are involved in building modules, you'll know that some of those are quite limited. What I might list as an essay in my module, someone else may list as an assignment as well. The defining or the definitions for what each of these mean isn't always clear as well. Obviously MCQs, etc. in there. Again, MCQs, what's the difference between MCQ and a short MCQ? When does a short one become a long one? And so on and so forth. The other thing is when you look at continuous assessment, it's great to see that there's almost 200 instances of continuous assessment in first year modules. When actually you look closer at those instances on the module descriptors, they're not actually, a lot of them, the bulk of them, are not true continuous assessment running through the module. You have a week 6 in-class assessment which has been badged as a continuous assessment. So again, you have to just be careful in how we interpret some of this data as well. Other things we noted, the module size varied widely, and some people were lucky enough to deal with only 10 students in a core first year module, but obviously others were dealing with much larger cohorts of students as well. Most of the modules had between 1 and 3 components of assessment, just under 80%. Interestingly, some had up to 8 components of assessment in a 5-credit core module, and others had none. So about 4% of the modules, so close to 30 core first year modules across the university, at least on paper, had no assessment. Fantastic for the students, but how are we actually giving the students the credits for those modules if in fact we're not assessing as well? And in terms of assessment being intertwined with everything we do in a module or within a program, I know many people make great efforts to make it clear how the learning outcomes in the module descriptor may fit with assessment within the description on the module descriptor where assessment plays a role, but only 1 in 10 on modules actually do that. So, are we really considering, and maybe we are as a module coordinator, but are we showing other people looking in, the students looking at the module descriptor, other people looking at our module descriptors, what we're actually doing in terms of assessment? In health sciences, we see a similar pattern, although the instances of exams drops down. Continuous assessments are in there quite a lot, but again, many of those are not true continuous assessments. Obviously, for many of our programs in medicine, radiography and physiotherapy in first year, there are a lot of MCQs, slightly less in the nursing programs than in some of the others. So a lot of MCQ components. And again, the mean number of assessments drops slightly in the health sciences programs, down to 2.2 components per module rather than 2.5, which we saw across the university. In terms of sequencing then, or timing of assessment, what we saw is the anticipated pattern of assessment. So in the middle of the semester, around week 6 or 7, there is a peak in the number of these in-semester assessments, but then the bulk of the modules are still examined by traditional end of semester examination. So this remains a crucial point for the students as an area where there's a lot of high stakes assessment still going on. What is a little bit more worrying across the university is, in terms of making it clear to students in planning further assessment, making it easier for stage or program coordinators to understand assessment at the module level, is some of the other fields in there. We have categories in the module descriptor where we can say varies through a semester, throughout semester, or unspecified, where we don't put in any timing or scheduling information on the assessment as well. A huge amount of modules across the university didn't have that information. Now, obviously, for true continuous assessment, it may be perfectly reasonable to state throughout semester or varies, but when we actually looked at the different components of assessment, that isn't actually the case. And we know practically as module coordinators what we're often doing is using that as kind of a safety net as such. We haven't decided or pinpointed exactly when that assessment will take place. It gives us a bit of flexibility. But from the stage, looking at coordinating assessment across a stage or across a program, we really do need to narrow things down a little bit more. So we saw exactly the same pattern in the health sciences programs, again with about 3 in 10 modules not having specific timing detail within their assessments. The next thing we looked at was 4 of the assessment design principles, some of which are related to sequencing and load. And in terms of sequencing, first of all, or load, one of the first principle is looking at regular low stakes assessment. So we saw just under half of the modules did have 3 or more components of assessment. So multiple components of assessment, reducing the stakes potentially for the students for having one big end of semester examination. They're building up their credit as they move through the module. The second part of this principle, though, is all around feedback. And obviously that feedback should ideally be, tailored feedback for each student and timely feedback for each student. So that impacts on their learning experience as they move through that module, so they can address issues, build on them, and hopefully improve their performance later on. Interestingly, or worryingly maybe, only 8 modules referenced feedback at all in the module descriptor, and only 1 module across first year in the entire university mentioned formative assessment as well. Other things that are in there in terms of that can impact on workload and sequencing are the use of self or peer assessment, or self or peer review as well. And again, it was only mentioned once in terms of self-assessment. Peer review cropped up across 5 modules across the university. And again, this is first year, and a lot of people will immediately say, well, self and peer assessment doesn't work very well in first year, group assessment doesn't work very well in first year. No matter where you put it, usually the students, whether they're postgraduate or first year students, they don't particularly like self and peer assessment. They often don't like the idea of group assessment. But when you sell it to them, and it can work very well, and one of my colleagues, Shane Foley, is going to talk about that a little bit later, about group assignment and self and peer assessment can work very well in first year. So again, similarly, not many instances of group assessment in first year. And one of the arguments for that is often the size of the cohorts we're dealing with in first year. Very large groups of students, it's hard to break them down into groups, hard to make group assessment work very well. But again, it can work very well. Looking more at, I suppose, professional programs as well, another thing was the active or task-based learning, which again, the instances within first year were particularly low. And again, in many health professional programs where we see our OSCEs, our clinical practice assessments taking place is in the later years as well. But I suppose if we want to more vertically integrate our assessment and look at scheduling longitudinally through our program, we should start to see more and more of those more skills-based or task-based assessments finding their way earlier into the programs. We followed up on looking at the module descriptors then by asking the staff, well, look, why are you doing this? What influences your practice? There's over 300 first-year module coordinators across the university, and we got a response rate of 30%, with the staff ranging from very new staff to very experienced staff in terms of their modules as well. We decided to build on the 13 defined modes of assessment within the module descriptor. We came up with a list of 32 modes of assessment and asked their staff about their use of those different components. And some, even with that list of 32, said, no, the type of assessment I use, it isn't accounted for within that list. Others were using up to 16 different types of assessment, not in one module, but across multiple modules that they coordinated as well. What's particularly interesting in terms of sequencing, you can see a lot of us, or a lot of the respondents, 96%, say that or state that they try to effectively sequence module learning and assessment activities. So at a module level, we're saying we're doing it, and maybe we are doing a great job of that on a module level, but often the missing parts of the jigsaw is how that impacts across a stage. I think we're quite lucky in the health professional programs that we do need to have a program level view, we do need to have a stage view. There's certain graduate competencies that we must make sure form part of our program. But in other programs, module coordinators work in complete isolation, in a silo. They do what they want, they think they're doing effective sequencing, but then suddenly all 6 module coordinators in that semester have assessments in week 6 of the module. Nobody is taking a more holistic approach across the program. Again, another reassuring thing is in terms of workload, or not reassuring, sorry, what the key considerations staff make. Obviously, we do consider our own workload. We are stating that we're considering the student workload. What is quite interesting and what influences our choice of assessment and how we design or sequence our assessment within our modules, we don't really think too much about what our colleagues tell you they do. We don't really think a whole lot about school policies or guidelines, university policies or guidelines. Even the pedagogy, the literature, the scholarship in teaching and learning and best practice, it's not one of the major influencing factors that's in there as well. Professional responsibilities, bearing in mind this is across the university, don't feature extremely highly. If we just look at health sciences, that number jumps up dramatically because we all have professional accreditation and certain things we need to do. In terms of some of the other assessment design principles, just clicking through this list, these were published by Bloxham and Boyd. They've been modified by UCD Teaching and Learning. But a number of these principles I'm going to touch on as well. Validity, effectiveness of assessment. Again, can we build on our assessment as we move longitudinally through the programme? The practicality or efficiency of our assessment needs to be considered. Trends in assessment are changing over time. We're moving from less written and theory, we're moving from less written exams to more continuous assessment. We're getting more explicit assessment criteria, which helps us and helps the students as well. And we are doing more group and task-based assessment as well. Some of you will be familiar with this diagram from instructional design diagram from Fink, where we sequence in and out of class activities. What it doesn't show is assessment, and if we consider a number of different approaches to assessment, a more traditional module where we have an assessment in week 6, a high stakes end of semester assessment, one with assessment in week 3, week 9, end of semester, one where we've 100% on a high stakes end of semester examination, and then one where we've no end of semester examination. Now again, there's a lot to say one approach may be better than the other, but probably what you want is a mix with any program. And again, this is the importance of looking at your sequencing across a program. While one approach like this may suit a certain student, other students may much prefer another approach. Likewise, depending on the module content and what you're actually assessing, maybe a more traditional approach would work better than a more continuous approach as well. There are key questions we need to ask about assessment, which will all influence different things. Can we reduce the number of assessments? Can we reduce the length of assessments? Students do get very stressed out, not just during the exam period, but now throughout the semester as we introduce more continuous assessment, and some of that continuous assessment becomes higher stake assessment as well. Also, from the staff perspective, we need to consider the workload. We've all been there where you're faced with a pile of 140 essays or assignments or 140 3-hour exam papers, and as you do progress through them, you start losing the will to live completely. When we're considering best practice, doing things like formative assessment and introducing feedback, again, it needs to be effective, it needs to be timely. It will increase staff workload to be able to do that as well, but it will dramatically improve the student learning experience as well. And variety of assessment can have multiple impacts as well. Just mentioning MCQ assessments as well, multiple choices, we have a lot of them in the medicine programme, and a lot of the professional examinations post-graduation in medicine are MCQ based. MCQs don't suit everyone. They suit some people, but not everyone. So variety in assessment is crucial, and again, that's going to impact on our sequencing. A couple of years ago, we went through the assessment redesign and mapping project, which nursing has also gone through, and there was a number of stages to this, but it allowed us to critically look at our programme. We thought we had a good balance of assessment in first year and across our stages in our programme. What we actually found was MCQs featured extremely highly within the radiography programme. Also in terms of the weighting of them, a 1 hour MCQ in one module was worth 15% of the module. In another, it was worth 40% of the module. So equity, that variability is something we needed to consider. A very useful thing, and one of the most important things I think anyone can do at a stage or program level, we do it at, well, hopefully we're doing it at a module level as well, is try and map our learning outcomes to our assessment as well. And this is just a screenshot from a tool we used as part of that assessment redesign project, where we have our program level outcomes listed. I've just got 2 of them listed there. 3 of our 10 core modules listed across the top. And by going through these in detail and mapping, are they introduced? Are they reinforced? In this case, it's not mastered. You may not expect it to be mastered in first year of a program. But then, are they assessed? This is really very useful. We thought we were doing everything within our program, but then we realised we had a number of our program level outcomes that were maybe only introduced and reinforced in one module in the entire program, where we had other program level outcomes that crop up in 20 or 30 modules. So, and then we have learning outcomes that maybe we're only assessing once throughout the program, and others that we're assessing 20 times throughout the program as well. So it's an extremely useful exercise. The final thing it allowed us to do in first year, and very important in terms of sequencing in first year when you're dealing with transition, particularly with school leavers, maybe a different approach is needed in a graduate entry to medicine program or the graduate entry to physiotherapy. Even within the nursing programs, you have slightly more mature students than we would in radiography or the physio undergraduate program would have. But, assessment for transition, thinking more about our students, phasing our assessment in the first year. So first of all, we're dealing with transition. We're allowing our students to develop. Then we're allowing them to achieve within those modules. So that mapping exercise will really influence your ability to do this. So just to summarise, obviously current assessment practices vary considerably across UCD, no surprise there. There are many considerations influencing our approaches to assessment, and in particular influencing our approaches to load and sequencing of assessment. It is very, very easy for us to assume that all is good within assessment, even as a module coordinator in our module, across a stage within our programme, or indeed across a programme. But really we need to look very closely and be critical about that. And when we are doing that, we need to consider all 3 levels I've just mentioned. We need to consider mapping at the module, the stage, and the programme level. Obviously, for those programs like ours going through professional accreditation, that's even more important for us to do. There are professional considerations, maybe on board alternates or CORU state that a certain subject area must be assessed in a certain way. That'll influence, or at a certain point within the programme. And obviously there's the staff and student considerations in terms of the student learning experience, but also their workload as well. So that's my brief overview. As I said, hopefully presenting more questions than answers. As Martin has already said, there's a series of presentations which will follow this, which will look at different aspects of sequencing, load, feedback, peer and self-assessment, the role of online assessment, and so on and so forth. So thank you very much, and enjoy the rest of your morning.